Three, two, one. Hey, Ads, how you doing, mate?
Hey Jason, how's it going?
Not too bad. So the first place I like to start with these is just tell people how you ended up with OP. Tell people how this all started for you.
Yeah, so mine I think was maybe a little different than standard. I did a 5K race. I didn't feel anything kind of happen during the race, but after the race, I had a lot of pain through both my adductors. I'd never had like adductor pain at all before. I think typically like with OP, it's kind of like a both like a gradual onset, but mine was kind of from 0 to 100. It was hurting really bad. First few days, I wasn't thinking too much of it, just that maybe I just raced and things I'm more sore than usual. But then after a couple of days where I really couldn't even get through my runs, I felt like I was running weird. Just I eventually started getting pain in like the actual pubis, like you're just kind of laying at night and it hurts and aches. Um, Eventually realized something was off. I think I took like my end of season downtime, just hoping it's just going to kind of go away, which it didn't. Then I went through kind of a PT process where I was kind of gradually rebuilding running, and they were working on me doing like kind of, just general PT. And it was improving from there, but it was still like I couldn't get through a training week. If I did like a workout, it'd be really flared up the next day. I remember I'd get like worked on it, it'd feel really good. I wouldn't do anything, thinking, okay, let me get some progress. And I'd wake up the next morning and just reset, it'd still be hurting. So I eventually went to doctors, got an MRI, and that's where I got the diagnosis that it was osteitis pubis. And they told me pretty much like your hip is fine and you could run, but you have osteitis pubis. So it's a bit open ended. Not like a standard injury where I've gotten where it's like, here's what we're going to do to fix it. They gave me the Holmick protocol, which I think was like maybe one of the more well known
Mm.
uh, things to fix it. I started doing that. I was doing that like religiously for maybe a month or so. Tried to like I was able to do kind of regular running, but whenever I do like a workout, like I'd get through that fine, but then like a few hours later, I'd be very flared up. I couldn't run the next day. So I did that. It didn't work. Then I did PRP, which was the other thing they suggested to me. That was like a long process of doing it and a slow rehab process. Back again with the whole home protocol. Then I went to a PT, a different PT, and they gave me orthotics, working through a bunch of stuff, and then it kind of always got to the same phase of where I could get some like regular running in, maybe at like half my normal volume, but once I got to do ending like a little bit faster and not even that fast, like maybe like marathon pace or faster, I'd get flared up and I couldn't like get through the next day of running. And then it kind of came to probably about a year after I initially had the injury. I think around then is when I kind of found your YouTube videos. And at that point, yeah, after it had been a year, I was kind of thinking it seemed like there was no end in sight, and I'd already tried a million things, so I was gonna, give your stuff a go. Uh,
It's always at that point that they're willing to try the crazy Australian on the other side of the world on the internet.
yeah, yeah. I wish I actually knew about it earlier. I mean, I probably found out about it maybe like a month or two before I actually like set up the
Mm.
consultation. At that point, I was like, let me at least finish what I'm doing with this PT and see if
Yeah.
this works. I think it was really when I got a year in, I was starting to like reflect because I've never lost that. Normally a big
Yeah.
injury is like a couple months, so a year was like starting to feel like this was coming to an end if I couldn't fix this.
It's funny though, because like if you think about it, right? Like so like I tore my ACL recently, like 6 months ago, sort of thing, 7 months ago.
Mhm.
And I opted to not get the surgery just because of like when you're my age, it just doesn't seem to work as well. Like you get the surgery, it's fine, but you can never play basketball again. It's like, what's the point?
Yeah.
So I opted to not get the surgery. That took me maybe 4 months to get back to the point where I was playing, maybe, yeah, 3.5, 4 months to get back playing basketball, 6 months before I was playing at the level that I was used to, kind of things. And now, like 7 months, I don't even think about my knee anymore unless I like the only time I can't really sit cross-legged really comfortably. That's about it. Is the only thing I can't do with it. That was 6 months for like a complete ACL rupture, right? And then OP, which theoretically should be easier to fix if you get it earlier, right? Like, there's nothing's broken,
Yeah.
nothing's torn, stuff like that. But yeah, people lose years of their careers to like, or, even if they're an amateur, years of their best running years and playing years and stuff like that to an injury. Yeah, it's brutal and it's like rough what people go through with that. What you mentioned about the home route protocol, though, is really interesting. What people don't often realize, anyone watching this, is just like, oh, that protocol does have things that work and stuff like that. And it's definitely worth a try in some ways. But the problem with it is that, like, one, like when they did that thing and they did that study, they've got like 15 physios across one athlete, and that's a professional athlete, I think, that they were using as well. So it's like, oh, the deck is really stacked in their favor to kind of make that work. Like they can position that person in the perfect angle to try to target the perfect tissue and stuff like that, sort of things. And you're already dealing with professional athletes, and who knows what other treatment and stuff they were getting on top of that kind of things through there. It's like, oh yeah, like there's good stuff in that. I certainly borrow stuff of that in my program and things like that. But it's like, oh, it's the problem with sometimes medicine, I think, a little bit. It's just like, oh, we did this study, this works, do this, it'll be working. And it's just like, oh no, those are two completely different worlds, different athletes, different people, different sports, different everything that goes there. And there's no adaptability to it. It's like, this is the protocol, this is how you do it, kind of things. But yeah, it's really interesting because like so many people have this exact same story. And it is just this like interesting process where it's like, oh, you see why it happens because medicine is like this and people are like this and they have issues like that, stuff like that. Okay, so you decided to go ahead. We met up. You started going things. What was the thing that you found hardest to begin with when you started the process and you started jumping into it? Did you find anything difficult? What was hard for you or anything like that?
It's probably just maybe the first 2 weeks having to get into a rhythm, or maybe kind of understanding how things were going to go. Maybe at first it's like a little overwhelming with all the videos and kind of how you should prioritize things or maybe questioning if you're doing them right. But I think after a few weeks, at least I got into a rhythm where, you have like my appointment with you, and then there's like 2 days later, I have to send you exercises. So like focusing on those, and then I get your feedback, at least for me with the time zone. I'd like
Mm.
send you my videos at night and I wake up and I'd have feedback because it'd be
Yeah.
daytime for you. It worked out very nice. So I'd get your feedback pretty much immediately, which was really helpful because if you're like me, where it's like maybe I tend to overanalyze some things, and it was good when you kind of explain everything in the video how it should be, but then obviously you can't get everything perfect. So maybe I'd be looking at stuff and thinking I'm kind of bad at it, and then you'll tell me I'm good at it. But then there'll be some other very small thing that's I don't think it's an issue at all, and you'll point out like that's something we need to fix. And then yeah, once I get your feedback, I didn't get to send your videos in like another 2 days. So I just kind of focus on all of those exercises. And then I do like the exercise where you're like, just take a look at the very end. I kind of eventually, in the beginning, I think I was trying to like get good at those, which was too much time between all the
Yeah.
exercises. And eventually kind of realized, I think you just want me to know what they are. So you don't have to explain it to me in our session, and we can just kind of get right into it.
Mm.
So after a few weeks, I feel like I got into a pretty good rhythm, but it's definitely a little overwhelming at first.
I think to kind of summarize what you're saying there as well for everyone, it's like, oh, there's this like process of learning, right? It's no different to anything that you might do when you go to uni and stuff like that, where it's like or college, where you're like, oh, okay, cool. Like I learned something, I get exposed to it. It's too much. There's too much going on here. My brain can't compute it. It's like, oh, I need to break it into bits. And then it's like, for me, the biggest thing with rehab is just going, you have this like drift, right? Like you practice an exercise in front of me, you'll do it well. Like I have zero expectation that in 2 days' time, you're going to do it just as well. Like that's just an unrealistic expectation to have of another human being to be exposed to something, pick up the nuance of it and things. And yeah, if I'm right there in front of you, like that study, it's like, oh, I could just be like, oh yeah, ads, put your bum down here, bring the chest there, change this. Like it's really easy. But like, I mean, I do this all day, every day for like a decade and a half. It's like very easy for me to do that. It's very hard if you've never had OP before to all of a sudden do that. And yeah, that process of being like, well, no, send me a video. Okay, cool. Like now I can just show you what things, and even like what you're describing there, it's like, oh, I overanalyze things, but then there's this little thing that I didn't even think about, kind of things like that.
Yeah.
Like for me, the process of a therapist, like in any kind of therapy, right? Like mind therapy or like, physical therapy, is this idea of going, oh, cool, I have knowledge in my brain. You need that knowledge to get better. I just need to make sure you're understanding what you're doing, even if you can't do it perfectly right now, sort of things. And so then what Adam would do is he'd send me a video and he might not be lifting the weight heavy enough or doing enough reps of it or doing the rep for long enough for me to be confident that that's going to transfer and stay in his body so that when he starts running, it'll be strong enough, right? But even if he's making mistakes, if I can see he's making the right mistakes, I might literally go, hey, ads, don't worry about sending me that again. I know you know what you're doing now. Just keep doing it till you achieve this outcome. So it'd be like, till you achieve 50 kilos, till you achieve 45 seconds, till you can stop that pelvis from dropping and things. But it's like, oh, I can see in the video that you're trying to lift your pelvis up, just physically you can't do it right now, but you're doing all the right things. It will get better if you keep repeating, and then you will be able to see your pelvis level, and then you can just tick it off and know that that functional weakness is taking control off and stuff like that. And that idea of just like getting into a rhythm of just being like, oh, I get the videos, I send you videos, I get your feedback, I change it. What, to me, the most important thing from that people sometimes don't emphasize enough is just this idea of like, oh, that's a learning process, and you're now in a very efficient learning process to get better. Sometimes like people just, the forest from the trees can get so hard where it's just like, oh, like what about this and what about this? And I Googled this thing and now I think I have this condition. It's just like, oh, no, you move badly, you need to move well. There's a really efficient way to do that. And it's the same learning process that you would apply in anything, which is just repetition, advice, repetition, advice, repetition, advice until it's good, and then move on to the next complicated thing, sort of things like that. All right, so you start the process, you get into a rhythm and stuff like that. Do you remember, because like me and Adam, we did this a couple of years ago at least, but do you remember any instances or points where you really hit a wall, where you got stuck, or where something was really hard, or you just started to struggle when things were going well, and then in your rehab, and then all of a sudden you kind of got stuck? Do you remember any incidences or anything like that off the top of your head?
Yeah, there was one that it was pretty late in the process. It was actually when I think it's like stage 8 and 7, where I was doing the slam ball challenge, and it's starting to run, but it was like the slow circle running,
Hmm.
and I got calf pain. And at first I thought it was okay, this is good because that means it's kind of like instant feedback that I was, my form had changed, but then it just wasn't going away. I think we ended up having to spend like a whole session on trying to fix the calf pain. And I remember at that point I thought, it was getting in my head that I'm almost kind of done. And I think we ended up like, I think at that point the sessions were pretty spread out when you get towards the end. So I think
Yeah.
that like took like 2 weeks, and that I never thinking I was close, and then it was just had to work on this little thing that just wouldn't go away. And it seemed very obviously the circle run is very slow when you're doing it, like kind of like almost like as fast as you can run without walking, pretty much.
Yeah.
It's weird to get like a lot of calf pain from that, and it just wasn't going away. And I think we eventually worked through it, obviously, but that was like I think the probably the bigger delay I had in there.
So it's funny with that, right? So it's like you're trying to build, you like I always envision, not that I'm an engineer, but I envision people like trying to build a prototype for a machine, right? Like trying to build a new car or a new something or other plane. And so it's like, oh, you get it. You can see it. It's all built. It's all good. It's all shiny, right? It drives. And then you actually try to use it in your real life. It's like, oh, cool, the car drives. It's real fast on the track. And you drive it every day. And it's like, oh, every time I press the button for the boot doesn't open. Now I can't put my shopping in the boot. And it's like, oh, I keep running. And now the end, I keep the engine idling in traffic and it's overheating, and it's like, it's like, but it's fine. It's so fast. It works so well, but I can't do circle running. Like what the hell kind of things. And it's funny. So anyone watching this, right? I will make people run slow because you can't hide bad technique when you run slow, sort of thing. So at that situation, if Adam had run fast, he probably would have felt good. He would have felt fine, and he probably wouldn't have felt his calves. And the danger is, and I can't be definitive on this, but the danger might have been that, oh, you're not using your calves effectively. You're not using your feet effectively. Even though we've done a bunch of foot stuff, it hasn't transferred to your running. When you're running fast, you won't notice it because you're on and off the foot real quick, sort of things. But if your foot's not doing its 10% job, well, then your adductors or your pubic bone or something else is going to be taking that load. And so now you're running, things are great. You're 2 months into your training block and the pubic bone pain comes back. And you're like, what the hell? And it's like, oh, but now you're so far removed from that, like doing slow running and all that stuff. It's really hard to backtrack. It's really hard to go, hey, cut all the running out. We need to dissect this again. It's like, it's an even bigger emotional blow. It's like, oh, cool. It's like, oh, thank God the problem happened now. Like, this is good. We can fix the problem now. But it's so like gut wrenching because you can literally see, like, the car's built. It's shiny. It's like, it's got a paint a polish. Like, it's good to go, except it's not. And then you like things. And it's funny that there is no way to know those issues until you get to the next day. So like people always ask me, oh, how long will it take for me to get better? And I'm like, oh, cool. I haven't seen you at all, so I have no idea. Like if you put more work in, you'll probably get better faster. Like that's definitely guaranteed. The more work you put in, the faster you get better. But it's like, oh, you could fly through the first 5 stages and then get completely stuck at rotation and you're just bad at rotation. You're missing all the patterns. Or you could get completely stuck for 5 weeks on the first two stages and feel like this is going to take a year. And then you get through that block and all of a sudden you fly through the rest of it because everything's okay. It's like, oh, you have no idea how your body will functionally react to things until you get exposed to it. And then the trick is just kind of going, oh yeah, like don't drop your bundle. It's like, okay, this is going wrong. We'll just fix this problem. And if another problem comes up, we'll fix that problem. And hopefully there won't be too many kind of things. But yeah, it is kind of like, I can sympathize with that because I see it happens to so many clients where it's just like, oh, you can see it, it's all there, except you just can't. You got to build this, fix this little thing, fix this little thing. And it's just like gut wrenching doing it. As I say. Okay, so what was the point, right, when you were sort of like, you were going through this where you were kind of like, not me or my therapist say, but this process, this kind of like systematic process of changing functional issues and changing it. Can you remember a point where you were like, oh, this makes sense to me. Like this makes sense to me. This will like, I just have to keep changing bits of me until I like almost physics wise, mathematically work as a runner kind of things. Can you remember if there was a moment or was a point where you started to think that way about your body as opposed to another way kind of thing?
Probably maybe after like stage 5 or 6, where more so I think like the first few stages like focus on just like the foot or just the glute, and then eventually it's like foot and the glute together was your core. Once everything started kind of combining into each other in the later stages, it became pretty clear. Kind of all the previous stages were building up to get to this, and then eventually you start doing stuff faster. That made sense to make things more kind of rhythmic. And then in general, when you kind of have maybe the start of each stage, there's like one of your like core videos, you're kind of just, it's not really a rehab video, it's just explaining here's how your obliques are supposed to work, or
Mm.
more like a educational video.
Yeah.
At least those became pretty clear. Maybe I wouldn't normally think like that prior to the program of, if something hurts, just strengthen it type of deal.
Mm.
Um, Whereas here, it's like, I know if I did get better, if I did get through the program and my OP pain was gone, there's also a chance I'd be more efficient. Just because we weren't really just strengthening stuff. We were actually kind of changing how I move, and the way you're describing it with all those educational videos, it was clear that those are more like efficient ways to run.
Mm.
Um, and some of that I already kind of known, so it was good to see like when you're throwing in, you want my foot to strike like this, and it's that made like a lot of sense. And how mine, if I'm currently heel striking, obviously I was like more efficient to midfoot strike, and all that started to make sense. But normally before the program, I wouldn't ever really know how do I change that. Um,
And to even like to kind of like go into that in a little more detail, it's that idea of like, oh, if you can see the whole structure, then you can understand how a broken piece fits in the whole of an issue and stuff like that. And even like the idea of like, oh yeah, like it's like even so like, yeah, it's bad to heel strike. It's good to midfoot strike kind of things. And like for you, that might have been something that kind of things. But like for me, it's even like, oh, okay, what does heel striking mean to your body? What does midfoot striking mean to your body kind of things? Because like sometimes with other people, I get the opposite problem where they will come in and they will be landing on their midfoot or the front of their foot because they've read something and it's told them that's the right way to run. And so then they'll force it. And I'll be like, oh, your midfoot strike actually doesn't agree with the rest of your body. Like you're forcing this, but your leg is not in a position to midfoot strike, and neither is your hips, and you're not rotated in a position to take advantage of the midfoot strike. It actually kind of makes more sense for you to heel strike, or you need to change all those other things to accommodate a midfoot strike. And don't get me wrong, if you land on a midfoot strike, you're going to get better glute activation. You want to eventually get to that point. But it's this idea of being like, oh, even like you don't want to just isolate the foot and then think about that. It's like, how does it all fit in the chain of like how your obliques engage with your midfoot if you midfoot strike kind of things, and trying to get a congruent version of running or walking, whatever the hell your sport is kind of things, that actually agrees with all of your body so that nothing is being exposed to excessive force because you read an article that says it's better to your arm swing sits like this than it goes back like that sort of things. Because yeah, that to me, that strengthen this, change this, fix this one specific thing, it just creates so many problems elsewhere in the body because it's such an isolationist view of kind of the world and the way the body works and stuff like that sort of things. I was going to say, okay, so just dovetailing that a little bit. if you wouldn't mind, like, do you just talk about how you now, so let's say you're in the middle of your training block and something starts to niggle you, or you're in like, you're thinking about how you're going to plan out like your next 3 or 4 months. But how do you now, when something goes wrong in your body or you want to improve something, kind of what's your mindset now versus before, how you go about tackling that and kind of thinking about that sort of things?
Yeah, definitely now add in, I guess maybe prior to the program, I would think just strengthen that area. And now it's more, maybe I'll still strengthen as kind of like a fail safe, but also let me maybe quickly record myself if I haven't done that in a while, because that's something we did a lot in the
Nice, yeah.
program is doing that. And then see if I can see anything wrong there and then kind of try to associate it with maybe some of our exercises that we did through the OP. Because really, in your protocol, we pretty much go through the whole body, whether upper body down all the way down to feet. So I kind of have something for everything to kind of look back on. And
Um,
I'll just try to improve that. And then I know from, sorry, my cat's yelling at me right now. I think it's like 5 days for like a nerve to be
yeah,
repurposed, or
yeah.
like a couple weeks for the fascia changes. So I know, like, let me do some of that stuff, but it's going to take, I'm not expecting like instant improvement where maybe if you do like strengthening for like a week, you just feel stronger. I'll do it for a couple weeks and then I'll check up on it then and see if I actually notice some changes or some improvements.
And what Adam's getting at there. So really briefly, yeah, it's 5 days to grow a new nerve. It's about 21 days to grow a new fascia and stuff like that. So if you're trying to create a neural pattern, so like you're trying to connect, say, individual muscles from your feet to your glutes or something like that, it's going to take longer. It's going to take 5 days and longer to create that connection. But let's say if you're just trying to strengthen your glutes themselves, that you can do almost instantaneously because there's nerves there. And so by firing them, you're training your body just like, oh, fire those nerves harder, fire them no harder. And then it's telling the muscle, grow larger, like create more fibers within you to get larger. So that stuff can happen almost like, within hours, you'll see changes in that. But patterns take longer. And that's why, you can go and play tennis and stuff and suck. And then you show up next week for a lesson and things just start coming together because the nerves have actually knitted and you can create those cross chain moves. But what Adam's kind of describing there is like even just the act of him going and like, oh, let me record myself is like, it's almost like, oh, rather than just going, this hurts, let me go fix this straight away. It's like, oh, let me get a top-down view. Let me record myself. Let me gather a bunch of information, get like a whole picture of what's going on here, and then be not so much surgical, like you'll know exactly what to do straight away. But it's like, oh, I'm gonna think broadly. I'm gonna be like, oh, let me try that. Let me see what that's doing. Let me like go here. Let me kind of like take a lay of the land. And before I really drill into doing it one way, I'm going to figure out what my best hypothesis for success is here, sort of things, rather than going, my leg hurts. Let me Google things. Oh, hip drop, glute med strengthening exercises. Cool, like that'll fix it, sort of things. And then creating other issues. It's like what Adam's describing there is just this sense of being like, oh yeah, I'm gonna be strategic about how I do this, and then I'm gonna make changes, see how they work, and then kind of like slowly figure out exactly what's going on here. So I actually, when I fixed it, it's fixed and it's done. I'm in control, kind of things. Okay, so then just last questions. If you had any advice to anyone who's going through the program at the moment, or even just like, is thinking about doing it, or anyone who's just going through OP and just struggling, like what is it that what is it that you thought about or you did or that you kind of changed within like how you approached your problem that kind of got you to a place where you could get better kind of thing?
I think, at least for your program, I think you definitely need to put the time in. I think you're pretty upfront about that. Whereas like I think other, maybe like yours is like every day you got to do, like I think you're like, if you do, as long as you do like an hour a day, and
Yeah,
it almost feels like the amount of stuff you give, it feels like you don't even achieve that much in an hour.
yeah,
Like it almost feels like I remember doing it and thinking I didn't do that much in an hour. Let me do longer. But then sometimes, some days you feel burnt out from that.
yeah,
But I never eventually just trust him. Let me just do an hour every day, and once I get through the protocol, like I'll trust that will work. And then you start kind of seeing those changes in, even if you don't feel like the pain go away, you see the changes in your rehab exercises, which kind of gives you that positive feedback. But I think the main thing is, for like, as long as you can have the time to at least like put an hour in, Like I think if someone does your program, they're gonna after a few stages, you're gonna see that everything's come kind of tying together, and there's a whole plan in place. Which I think with at least the stuff that I tried prior to your program, there wasn't that much of a plan. It was more just do this, and by that, like do the homework protocol. And by the time I finish it, I should be good. And then I wasn't, or do PRP and with the homework protocol and orthotics and all this other stuff. And there wasn't a real plan. Whereas with yours, it's after a few stages, it's pretty clear. There's like a long term plan, and the whole process is going to end. Where I think with before I started your program, it didn't feel like there was like any end in sight. And with your program, it was pretty clear. And it wasn't clear how long it's going to take me to get to stage 10, but once I got to stage 10, I could be pretty confident that it was going to resolve the issue, and that's pretty much what happened for me.
Awesome, awesome. Thank you so much for this. And yeah, anyone watching this, just hopefully can take a lot away from it. But yeah, like from my perspective, it's kind of like, and it's not like I'm 100% sure that I'd fix every single person that comes across me kind of things. But my thing is going, oh, if you have functional movement weaknesses, right? You can methodically address those and correct those. And geez, if your pelvis moves bad and you have pain in your pelvis and your pelvis moves better, there's got to be a damn good chance that you're not going to have pain in your pelvis at that point, sort of things. And even if and there has been the odd occasion where I'll do that, someone will go through 10 stages and there'll be certain things they can do and then certain things they can't do. But it makes the next steps from that, even like these, just being like, okay, cool, maybe you do need a little bit of PRP. And now the PRP works because you're not walking away from the session after PRP, walking badly and putting horrible pressure on the pelvis that prevents it from working or something like that. It's funny like that. But yeah, just this idea that like Adam's expressed really clearly, it's just that if you're just kind of methodical about how you go about addressing this issue, you can get predictable results from your body and stuff like that. And your body wants to heal. If you can do that and put it in a position to heal, it will heal and it will get better for things. But yeah, thank you so much for this.
Yeah, no problem. I really appreciate obviously going through the program. Like I was barely running before it, and this past spring I was able to kind of do a full training season, which hadn't done in years. So definitely got me through it. So
Awesome.